just going to highlight a few of the first research advocacy opportunities that I participated in order to give you some ideas of how you might want to get started if you're interested in research advocacy. The DoD, which stands for the Department of Defense, funds medical research on a variety of disease states, including lung cancer, and puts together panels of scientists and patient advocates to review the proposals that are submitted. Patient advocates who participate on these panels are called consumer reviewers, and they review the proposals for potential patient benefit, not scientific merit. You do not need to have any kind of scientific background to participate. Consumer reviewers need to be recommended by an advocacy organization. I was recommended by Longevity when I started doing this. Fill out an application and interview with someone from the program. I was placed on my first panel as a consumer reviewer in 2016 and have participated in 8 panels total now. It's a really exciting program because as a patient advocate, you get to work directly with scientists to discuss the pros and cons of various proposals that are up for possible funding. Often, there are things that we as patients bring up that scientists haven't really thought about because they're just so deeply entrenched in the science itself. Everyone gets an equal vote on each proposal, so consumer reviewers' opinions are as important as those of the scientists on the panel. While it's a significant time commitment reading all of the assigned proposals and writing comments, not to mention dedicating time for the panel discussions, the DoD is really one of my favorite research advocacy activities. I always learn so much through reading the proposals and participating in the discussions. I've made many valuable connections with researchers, and I truly feel respected for my opinions when serving on a panel. Important skills to have for this program include the ability to express your opinions comfortably, both in writing and verbally, and in a professional manner that really focuses more on collaboration than confrontation. It's also critical to be able to step back from your own personal situation in order to advocate for the best science for the lung cancer community as a whole. Next, I'd like to mention an AACR program, which I participated in after doing my first DoD panel. AACR stands for the American Association for Researchers during that first DoD panel. They mentioned it and suggested that I might want to consider applying for it. I decided to do that and ended up completing an application and getting recommendations both from one of these researchers and from Longevity. AACR focuses on scientific cancer research and has a number of conferences throughout the year, including an annual meeting. The Scientist Survivor Program provides a special additional track at AACR for patient advocates with separate lectures, small group workshops, and tons of opportunities to connect and ask questions of researchers. It was a great experience because I got to meet and work with advocates from all different cancer types, which was a fantastic way to make new connections. I also learned how to create and present a scientific poster, got to attend special receptions, and learned tons, all in addition to attending the AACR annual meeting. As a result of participating in SSP, I made many contacts in the research world, which led to other advocacy opportunities. Again, it was a significant time commitment, which included attending pre-conference calls, developing a poster, and participating in work group meetings and presentations. Important skills to have for this program included a strong interest in collaboration across backgrounds, plus a certain degree of confidence in order to take full advantage of the networking opportunities, many of which take place informally at receptions. I've now been part of the program 3 times, twice as a participant and once as a mentor. Other conferences, in addition to AACR, have programs like this as well to encourage and support research advocacy. A great program that is relatively new is the IASLC's STARS program. I've only participated in this program as a mentor since it didn't exist when I first got involved in research advocacy. The STARS program focuses specifically on developing research advocates for lung cancer and teaches participants both the science they need to understand in order to be an effective advocate and ways to improve their communication skills. Those who participate in STARS learn from each other, subject matter experts, and mentors who are more established research advocates in the lung cancer community. The program culminates in either virtual or in-person attendance at the World Conference on Lung Cancer, where participants can put their new skills into action. Then they take these skills back to their communities with plans for future advocacy work. There are also opportunities to advocate for the specific type of lung cancer that you might have. As I mentioned earlier, I learned that not all lung cancer is the same and is not treated the same when I was first diagnosed. As you now know as well, there are many different types of lung cancer. As you can see from the pie chart on the left, lung cancer is first broken down into two main types, non-small cell and small adenocarcinoma is the most prevalent type of non-small cell lung cancer. And recent research has shown that there are a large number of biomarkers that can drive adenocarcinoma. You can see some of these in the pie chart on the right. Different biomarkers mean different treatments, precision medicine treatments that are directly targeted to the genomic changes that cause cancer, like my EGFR mutation. Biomarker testing and therapies targeted to these biomarkers have allowed people with lung cancer to live longer and better in the past 10 years or so. As a result, they've been able to take a larger role in advocating for themselves and others. Advocates have formed patient groups for many of the biomarker driven cancers on the pie chart you saw on the previous slide. These groups are usually patient run and determine their own agendas, focusing on what they feel are unmet needs in their subset of lung cancer. However, they all have in common what they offer patients and caregivers. This is hope, support, education, empowerment, and connections. Many people who join these groups have never met another person living with lung cancer, let alone a tribe who shares their specific type of lung cancer. Some of the groups also participate in the patient driven research that I mentioned earlier. This is very important because as patients, we have critical information to share and a unique perspective. Patient-driven research can help scientists learn about a number of things, including disease biology. They can help them develop and test new treatments, identify best practices, generate ideas for new studies, and support regulatory approvals.